Hello and welcome. Very good evening to all of you. Thanks for joining us here on the weekend edition of the Urban Debate. I am Afrida Rahman Ali. Well, it is a 10-member panel appointed by the Government of India which has released its report on the progression of COVID-19 pandemic in India, the prognosis and the lockdown impacts. We are going to talk about the 10 important findings that this report talks about. The Department of Science and Technology, Government of India had constituted this panel way back in June to help monitor the future transmission of this infection so that it can help government take policy decision with regards to healthcare system, its preparedness and other mitigation measures. So that was the whole idea of constituting this panel way back in the month of June. The report is out. It's a preliminary report at this stage, but it has come out with some very important findings. We are going to look at that. Let's also tell you what was the composition of this committee. It included professors from IITs and IISCs, that is the Indian Institute of Sciences, besides other scientists. And what are the elements that it took into account? Well, this is supposed to be a national level supermodel based on the parameters, on certain specific parameters such as timing of the lockdown, alternative lockdown scenarios, impact of migrant workers returning home, and the future course of the pandemic and its trajectory in India, the way it has moved so far and the way it is likely to move from here on. So there's some important data which has been collated to draw out a pattern, the most likely pattern of the coronavirus in India. So that is how significant this report is. The panel has used real-time data set to make forecasts on the transmission, to gauge effect of the lockdown, migrations, and also project future scenarios. So that is where the importance of this report lies, because it does give us a forecast, things that could possibly happen. So what is the most important finding in this particular report that has made headlines? That is that by February 2021, this pandemic will taper out. The cases are going to taper out. So that is the big important point among several other findings. Like I said, this is a preliminary result of the panel, and detailed results, we are told, will be out in some time next week. So let's now introduce my guest this evening, Dr. Rakesh Mishra, Director of the Center for Cellular and Molecular Biology, joining us from Hyderabad. Dr. Shashank Joshi, Dean of the Indian College of Physicians of the Leelavati Hospital and also member of the COVID-19 Taskforce, joining us from Mumbai, and also Charu Pragya, spokesperson of the BJP. So we'll try and understand the importance of the findings that I just mentioned. But before I go across to that, I want to take our viewers through the graphics that we have made in terms of the findings and the concerns. Let's have a quick run through, and then I go to my guests. And thanks to all of you for joining us here on Mirror Now. So the finding, like I said, of the government panel, lockdown saved lives. That is one of the points that it has made. But the concern is that government really do enough to boost healthcare. That was the whole idea of the lockdown. It gives us figures on the number of lives that it potentially saved since the lockdown was imposed on time. The second finding, COVID-19 has peaked in India. So what it says is from here on, it is going to go on a decline. That is again a very important point that we are going to discuss. So is there a possibility of another wave? That remains a concern. And is India ready for it? So this is one kind of curve we are talking about. But as we have seen in other countries, there has been a relapse and a second wave. Another finding is that the upcoming winter season may increase the spread. So therefore, the concern is the central government, especially in cities like Delhi, doing enough to tackle pollution, which has become a phenomena associated with winter. Pandemic is likely to end by February 2021. This raises a lot of questions because obviously we don't have a vaccine yet. So we are going to look at it through that aspect of whether such a projection can even be made. Without the vaccine announced as of now, the hunt for the vaccine is still on. But this government report says the pandemic in India will end. It's good news for all of us. But should we be taking it with a pinch of salt? 105 lakh projected cases by February 2021. So the concern again is that has the panel really factored in the second wave while talking about this figure? And then, of course, another finding is that the lockdowns from now on are undesirable. That's what the panel report says. But what about the rampant violations of the COVID norms? What is the enforcement strategy before we say that no more lockdown? Will the COVID norms still apply with the same stringency? Precaution should continue, says this report, as India unlocks, and therefore the states under no circumstances should be going easy. Remember, the states are taking a lot of localized decisions. The move to fully resume activity is being taken now. Just like I said, no further lockdown, so all activities, especially business activities, are likely to fully resume. So there again, we are going to talk about whether the losses that have been incurred will be taken into account, and a recovery strategy also will be announced by the government. 30% of India's population has developed immunity as per the report. Then, of course, it also says no sharp rise in cases due to the migrant movement in particular. So those are the findings and the concerns which I just took viewers through that entire gamut of issues. Now let's go across to our expert panel, Dr. Rakesh Mishra. Good evening. Thanks for joining us. I want to begin by asking you the question that is in everyone's mind. This report says come February 2021, we'll be out of this pandemic in all likelihood, given the current trends and patterns. How do you see this particular finding, especially because we do not have a vaccine yet?
Yeah, so good evening. It's very interesting observation that the panel has made, and coming up with the date that February end and we'll be done with the pandemic. I'm not sure. It is difficult to say for two reasons. One is we cannot apply uniformity in the country. We have various pockets where things are not synchronized. All the cities, all the regions are not synchronized. So it's very difficult to say that we have passed a peak in India. Maybe in some cities, yes, but maybe many places we are yet to reach that point. That is number one. And number two, some places maybe we will be going other side of the pandemic, but as you mentioned, there are chances of second wave, third wave. Europe is already going through, many cities are having, many countries are having serious problems. So I'll be very happy if we reach a comfortable situation during the February end, but we have to do a lot to reach at that point. The committee has mentioned, government sources are already emphasizing that people have to do a lot, system has to do a lot before we can realize this situation that February end we will be other side of the pandemic. In current situation, I'm not so sure, because if we don't follow discipline and we cannot afford a lockdown, there is no way that we can be other side of the pandemic unless something specific and emphatic is done. My other point is this findings of the, there are very capable people who are members of this committee, and Professor Vidyasagar is a very renowned scientist in this area of statistics and so on. But your model can be only that accurate as the data you are using. So the model has used two kinds of data, this study. One is the dates and actions and activities. They are accurate, of course, when lockdown was announced, when people migrated and so on. But the other side of the thing which the model depends on is the data of number of infections, number of tests done, number of people dying. I'm not so sure the accuracy and completeness of that data, and therefore we might be making many assumptions which may not turn out to be accurate.
So you have your concerns. You say that there could be gaps in collection of data. So to put out a strong message of this nature may be premature. So perhaps you believe that precaution is still the better way to look at things, rather than hoping that we are going to be out of this by February, and therefore there should be no lowering of guard. Of course, at this stage, we are again at a very, very critical stage. This could be a make or break moment. Yes, there are certain gains that we have made out of the lockdown, no denying that, but we need to sustain that and take it forward from here on without showing any laxity. That seems to be the main point here. But I want to bring in Dr. Shashank Joshi, who's the Dean of Indian College of Physicians from the Leelavati Hospital. Dr. Joshi, one of the primary objectives of this entire panel was to assist government decisions with regard to healthcare system. So when you look at the findings, what are the takeaways you think that could help policy making, that could help mitigation measures, being somebody who's been at the front line? Do you find this kind of report useful in making decisions?
Before we say that, we must understand that biology doesn't follow mathematics. Virus is predictably unpredictable as far as coronavirus is concerned. And number three is that this report is very insightful retrospectively. So I think it is very insightful when it looks at the past, that whatever government did right from lockdown onwards was appropriate, correct at that juncture, and allowed the healthcare infrastructure to be built. For example, both the central government, I want to compliment them, and the state government have done an excellent job in ensuring that the lockdown and the unlocking process has been appropriate. But now the ball is not in the court of the governmental authorities. They have made their preparedness. It is in the hands of the citizens now. And the citizens need to behave appropriately for any model to work. And I don't think that's happening. And that's my concern here. The second thing which this report tells very clearly is that pandemic will end by February. I don't think anybody on planet Earth can make such a prediction. So that's a little preposterous. But all the things which they have talked of the past, including the lockdown, the lives saved, that is reasonably accurate and correct. Maybe many more lives may have been saved beyond what they have predicted. So retrospective part, I accept. Prospective part, I don't accept, because that needs an element of unpredictability, the nature of the virus and human behavior. Human behavior is so key. COVID appropriate behavior is the key. Maskings, distancing, cooperation from people at large is so key. Yes, our public health infrastructure has been ramped up in large geographies like Delhi and Mumbai. They have built jumbo facilities, beds have been there, preparedness has been there. But if the citizens don't cooperate, none of these numbers would look up. So my appeal is to every citizen that you need to be
absolutely. So you have made a good point that in retrospective, in hindsight, we are all wiser, and therefore it's all very well to make those points. But in terms of predictions, you're saying that you would still exercise caution in accepting the projection, especially the projection with regards to February. I'll come back to you. I want to ask you specifically about Maharashtra. And also, we have to understand how much of this is because of government measures and how much of it is simply because that's how the pattern is with a pandemic of this nature. But let me bring in Charu Pragya, spokesperson of the BJP. Good evening, Charu Pragya. I want to ask you, the government's role in this is extremely critical, but the part that is disappointing is the kind of mixed message that we get. On one hand, you have the union minister asking for restraint, saying charity should take precedence over any kind of devotional activity. He's saying, I'm going to be restrained over my festivities. But your party in Maharashtra is clamoring for temples to be open. They have no qualms about the fact that there could be public gatherings. So don't you think that the government has not come out with a strong message for the public when it comes to observing the COVID norms? And that kind of laxity could prove to be costly for us.
Afrida, I would agree with you on some points, but let me begin by saying that this pandemic has shown us how Prime Minister Modi has been a true leader of the people. Can you imagine a country like India, a vast and diverse country like India with the largest population, free population in the world? Let's not count China, because China seems to be a completely different story altogether. But the largest free population of the world in one place where the language changes, where the culture changes, and we have a Prime Minister who comes on television and appeals to the better sense of the people. And what do we have? We have a situation which has been handled in, I think, an exemplary manner. India has come out a leader after this, and we have done so well on so many fronts, starting with how we take care of our medicines. We don't just take care of the local requirement, domestic requirements. We have been able to export these medicines, how we've taken care of the rising needs for the N95 masks and the PPE kits, so on and so forth. So I can go on and tell you examples about this. But coming back to your very specific question about how the party is doing, let me be very clear about one thing. Bharatiya Janata Party is unanimously clearly and very strongly talking about how important it is to follow all the COVID norms. If you will notice, the Prime Minister is tweeting about it every single day. All the union ministers, the senior leaders of the party are repeating what the Prime Minister is saying, and it's been followed on ground. And if you are talking of temples being opened in Maharashtra, I'm sure you're aware the temples are already open right here in Delhi. When you look at how this virus has found, hubs, so to say, core areas where the influx has been larger than other areas, Delhi has done terribly. It has done very badly. So why did the CM of Delhi go on and open the temples? I think what we need to understand here is that we have to
No,
strike
my
a
only
balance.
concern is enforcement, Charu Pragya. I get your point that in some areas the government believes that it has taken the right measures, but let's not forget that there are still some extremely delicate areas in terms of recovery from lockdown, in terms of enforcing. How will you now enforce the COVID norms with public transport opening up? That's a huge concern, especially in a city like Mumbai. Metro services are opening up, local trains are opening up. This report says we are not going to go into any lockdown mode any further. Therefore, there will be a lot of concerns whether the government is going to be stringent enough in enforcing COVID norms. The netas are the first ones who breach all norms and who do not wear masks, and we have shown so many of those reports. Let me quickly go across to Dr. Mishra once again to understand that when we talk about the fact that India is now, on the path of recovery, if we go by this report, how much of it is because of the measures like lockdown, etc., and how much of it is simply because the virus behaves in a certain pattern? And this is how it is with other countries as well. So the importance of the measures taken by the government in this regard, what would you say?
It's absolutely clear that lockdown does help. There is no question about it. The only debate is lockdown comes with a price, which at some point may not be affordable, and we all understand that, because sometimes it may be worse than the pandemic if you keep lockdown for a long time. So certainly it has helped. There is no question about it. It gave us the time to prepare the hospital compared to beginning in April, March, beginning of March. And what we have is in terms of preparedness, in terms of hospital beds, ventilators, ICUs and all, remarkable build-up. And things like PPE that we were not even making, now we are in position to export those things. That's the one thing, we are better prepared. Second thing is we understand the disease much better now. We know that what kind of treatments are required, whether you need certain kinds of medicine, blood thinners and so on, so we can take care of the patients better than they were taken care in Europe and America, because now we have understood. We means a scientific community. So that has certainly helped a lot. It is not the virus is equally infectious now also. It was never more dangerous than this, and it's not less dangerous than it was before. It's just that we have learned how to manage the disease. If the same level of...
Let me get a reaction on that from Dr. Shashank Joshi as well. Yes, because you said that this has helped, but Dr. Joshi, from your experience...
I think yes, I would agree with
would you agree with that point?
Yes, I would agree with Dr.
The period of lockdown was utilized effectively by hospitals, by the government to ramp up facilities. The critical care is extremely important because those who need ventilator support or oxygen supply, that is the area we usually get stretched. So is that being taken care of adequately because of the lockdown?
I would agree with my panelists completely that India has emerged in the health preparedness very well. And I think we have the best recovery rate on planet Earth. We have one of the lowest mortality rates on planet Earth. So our treatment protocols are in place. We understand the pattern better. And if it was not for the lockdown, we would have had a disaster and a mayhem. So clearly we have to congratulate them where they have done a good job. And I think the lockdown and the preparedness has gone hand in hand. Both center and state have worked together as one team when it comes to healthcare preparedness and healthcare treatment policies. So I think as far as the science and the medical science delivery is concerned, I think we have risen up to the occasion. And I think Indians at large have done much better in terms of recovery and the saving of lives. We have one of the lowest case fatality rates in the world. If you go to Europe and United States, it has been a disaster. compared to them, I think India has emerged as a much better
Yes,
COVID
but then we
care.
are also a young country, and yes,
I
the
would differ
age
there.
group
We have one of the
factor is
largest
also probably
comorbidity.
there in terms of, you know, getting that advantage.
Yeah, ma'am, but I would beg to differ because
Okay.
we have the largest comorbidity, we have the largest population of hypertension, heart disease, diabetes in the world.
Okay.
And despite of all the adversities, we have done extremely well. And also remember, we have a handicap. We are not economically as vibrant as the Western world is. And despite of all our public health infrastructure inadequacies, we have outperformed. And I must congratulate our full team for that.
Afrida, can I come in, please?
All right, that's a good point to end this discussion. Yes, very quickly, Charu Pragya. I have to close after that. Please go ahead.
I'm in agreement with Dr. Joshi. In fact, you know, in India, we've not seen instances like shop looting, hoarding, like it's been happening in the Western countries. So Indians by far have shown their very kind and cooperative nature, and the government has played its role in a perfect manner, guiding people, helping people, and even the migrants' labor were looked after. A lot of political mess was created because of the opposition trying to lead them all, but in the end,
I have to point out there that it's not enough to say migrant workers were looked after. I'm sorry to say that is not the picture that we get from our ground reports. I have to interrupt you there also to tell you that yes, so far so good, but going forward, enforcement and vigilance is the government's duty. And also, let's not forget, while you tell us that, okay, no more lockdowns, but what will you do to help us recover those losses incurred during lockdowns? Will the migrants be left high and dry? Because now when they come back to their cities of where their workplaces are, they are not able to resume work the way that they used to work before migrating to their home states. What is being done for them? So clearly, it's all very well to say that, well, we have done good so far, but going forward, there are multiple concerns and there are grey areas which the government will have to pay special attention to. I would like to thank all my guests for joining us here in Mirna this evening for this discussion, and thanks to all our viewers for joining in the conversation.